This is CCTA case number 33. The history is a 55-year-old man with a long-standing history of hypertension and now has some excessive shortness of breath. This is a 10-phase study for evaluation of left ventricular and right ventricular function. It is an ECG radiation dose modulated study such that the images at end diastole are not as good a quality because they've turned down the milliamperes on the scanner. The images are far better at end diastole. This is commonly done to provide adequate views of cardiac function, but also reduce radiation dose and concentrate on having the best quality images in the end diastolic phases, which are usually the best phases for looking at the coronary arteries. So we have here a three-phase view, three-panel view. We're going to look at this situation now by, first of all, changing the overall view into the standard cardiac. Here we now have the presentations made in the standard cardiac views. In the upper left we have the horizontal long axis, in the middle we have the mid-ventricular short axis, and in the lower left we have the vertical long axis view. These are best viewed in a 2x2 display. We'll change that to a 2x2 display. We can now examine the cardiac function by looking at the cine controls. These are now displayed here in the mid portion of that. We now have the images displayed in a 2x2 format, short axis, horizontal long axis, vertical long axis. Let's now try to cine this by moving the cine controls. We have these in the middle here, and by hitting the play button I can display all of these and all of the 10 phases. And first of all, see that the left ventricle function is normal to probably hyperdynamic. The left ventricular chamber appears to be of normal size, although we can make a distinct measurement of that, and we see no clear abnormalities in regional wall motion. In the horizontal long axis we have the septum, apex, lateral wall. In the vertical long axis we have the anterior wall, the apex, and the inferior wall, and then in the short axis view we have the individual anterior, lateral, inferior, and posterior septal segments. Let's stop this for a second and try to concentrate on what appears to be an end diastolic phase to get a little better idea. We want to get to the largest size. Well, that looks like about that point. Let's then concentrate on that particular area by increasing the size of that and then looking at wall thicknesses. Now, this patient does appear to have probably some element of what you might call hypertensive hypertrophic cardiomyopathy, but let's take a little idea of getting an idea of ventricular wall thickness. I'm going to go to the septum here and pull up the 2D tool and then try to get an approximate end diastolic measurement here, getting about 12.7 millimeters. Upper limits of normal is about 10, so this is moderate hypertrophy. Let's take a measurement of the lateral wall. Same thing here. We'll try to pull up the menu and get a general idea of where that is. That's about 9.8, so somewhat asymmetric, moderate hypertrophy of the septum, and also some hyperdynamic function, but otherwise normal left ventricular function. Let's just for a second remove these two areas. Let's also now look at the right ventricular function, and I'm going to hit the cine button here. Now, there are some issues here that can be seen in the right ventricle. If we look at this in the short axis, it's clearly not dilated. It appears to have very normal function, but you get the idea that there is some right ventricular hypertrophy. This should be normally quite paper thin. So we have some element of right ventricular hypertrophy. We clearly have left ventricular hypertrophy. We have normal systolic function of the right and left ventricles with normal chamber sizes.